Hi everyone, my name is Dr. David Kulla. I see a lot of medical information, misinformation out there on the internet. Also a lot of support groups for stenosis and disc herniations. I want to clear something up, and also sciatica, which is usually a symptom of a disc herniation. Doesn't always have to be, but usually. That being said, a lot of negative and really positive comments about chiropractic, but there's a lot of misinformation about chiropractic in those comments, right? So, I mean, have you ever been to a bad dentist? Yeah, you don't stop going to a dentist, you find another dentist. Same thing with chiropractors. There are bad and there are great chiropractors, okay? And sciatica is hands down a chiropractic case. So many of you go into PT. PT is a study of soft tissue, muscles, tendons, and ligaments. If you have piriformis syndrome, sciatica, then it'll help. And don't get me wrong, PT helps sciatica, but sciatica needs something specific. And chiropractic, all the techniques are not the same. So people are going and they're comparing their experience with a chiropractor and what technique did he use? How many times did you go see him? There's so many questions out there and there's just so much misinformation. I want to clear it up, okay? First of all, there is a technique for sciatica, for disc herniations and spinal stenosis. It's the gold standard in chiropractic techniques for those conditions. And the technique is called Cox Flexion distraction technique. Some chiropractors have the table, are not certified. A lot of doctors are certified and have the table. You hope that's the case. They do require you on their website, coxtechnique.com, spelled TECHNIC.com. So technique is spelled a little differently, but those are updated, currently certified docs. But there are plenty of docs that are out there that have been certified a few years ago and just haven't updated it. We have a lot to do, a lot on our plates as chiropractors, a lot of certifications to keep up and to do. That being said, you want the doc certified in the last 10 years, I would say, because things do update, the technique updates. Also, for us, we treat sciatica with Cox technique and cold laser therapy, and we have amazing results. So I see all these comments, chiropractic made it worse. It's, you know, you were already bad. So when you went to the chiropractor, did you follow through? I mean, there's just so many questions out there. Don't take those as stock and barrel, those comments. Try yourself, see a Cox Flexion distraction chiropractor, somebody with good reviews, look them up. We've been doing non-invasive, non-surgical techniques really effectively. We get so many referrals from orthopedic surgeons for people that just don't want injections and they don't want medication, pain management, or worse, surgery, nerve blocks, things like that, fusions, discectomies, laminectomies. I mean, the list goes on, the different kinds of spinal surgeries, and the outcomes are horrible. So look into Cox technique and cold laser therapy if you're dealing with sciatica or herniated disc or spinal stenosis. I promise you, if you follow through with the doctor's directions, you will get great results. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.